Hello, my name is Mike Connor and I'm the Vice President of Frontline Mobile Health. Your department has selected our team to administer the comprehensive occupational medical program. Our offer is to reduce suffering and prevent the onset of disease through education, data analysis, and one-on-one interaction. While there are many significant health concerns for first responders, heart disease remains the single greatest cause of line-of-duty deaths and also one of the most preventable. Many of you are familiar with or have undergone treadmill testing in the past to evaluate for the presence of cardiac disease. However, technology and our understanding of the cardiorespiratory system has advanced beyond this, and many of the leading organizations rooted in cardiovascular health, to include the American College of Cardiology, the American Thoracic Society, the American College of Chest Physicians, as well as the American Heart Association, all endorse cardiopulmonary exercise testing, or CPET, as the preferred method for diagnosing cardiac disease. CPET provides a global assessment of your body's ability to respond to physical stress while evaluating the pulmonary, cardiovascular, metabolic, neuropsychological, and skeletal muscle systems simultaneously. This gives you a true assessment of your cardiac risk and the information needed to make positive change for your long-term well-being. The following video will provide a brief overview of the test and some of the key indicators we are looking for to help you understand your cardiovascular health better.
Hi, my name is Alex Jesko, and I'm the exercise physiologist here at Frontline. I want to first cover the importance of assessing your cardiorespiratory fitness, or CRF. CRF reflects your overall physiological function, especially that of the cardiovascular system. Many factors can contribute to your CRF, including gender, age, ethnicity, and genetics. CRF is an independent marker of risk for cardiovascular and all-cause mortality. It is a stronger predictor of mortality than established risk factors such as cigarette smoking, hypertension, high cholesterol, and type 2 diabetes. Your CRF will be expressed as the volume of oxygen, or VO2, that's relative to your body weight. High levels of CRF are associated with improved outcomes for certain forms of cancer, dementia, and Alzheimer's disease, depression, type 2 diabetes, metabolic syndrome, as well as decreased risk of complications when undergoing surgery. Increasing your CRF by as little as 3.5 mL per kg per minute is associated with a 10 to 20% decrease in mortality. To decrease cardiovascular risk, exercise regimens should be implemented with an initial target of increasing your CRF by 10% or more. Measuring your CRF is accomplished by performing what is called a cardiopulmonary exercise test, or CPET. CPET is a highly sensitive, non-invasive, and technologically advanced stress test. CPET is performed on a stationary bike while the patient wears a mask. It assesses how well the heart, lungs, and muscles work individually, as well as how these systems are working together. CPET measures the amount of oxygen your body is using, the amount of carbon dioxide it is producing, and the exchange of these gases in your lungs, your breathing pattern, and the electrical signals emitted from your heart. CPET is significantly more accurate in detecting ischemia and early-stage disease at a microvascular level, and can identify a multitude of conditions much earlier than traditional methods. At the beginning of your CPET, you will be asked to perform a pulmonary function test that assesses how much and how well you can move air through your lungs. After this, we will place several electrodes on your chest so that we can monitor your heart during the test. And you will also be fitted with a face mask that you will wear the entire length of the test. Your blood pressure will be measured every 2 minutes while on the bike. The test takes approximately 20 minutes and consists of a 3-minute rest, 3-minute warm-up, and about an 8 to 12 minute exercise session, immediately followed by a 5-minute recovery or cool down. When the warm-up starts, you will begin pedaling at a cadence of 60 RPMs, which will be displayed between the handles on the bike. During the exercise portion, the bike will increase the resistance every 10 seconds incrementally until you reach failure. In essence, the exercise portion feels like a nice bike ride through the park for the first 4 minutes, and then at the 4-minute mark, you'll begin climbing a never-ending, increasingly steep hill. The last 30 seconds will overload your muscles to the point of exhaustion, and your goal is to hold on to 55 to 60 RPMs as long as you possibly can. When you can no longer maintain the desired RPMs, the exercise portion will be stopped and you will enter the recovery stage, riding down the giant hill that you just climbed for 5 minutes while you recover and finish the cool down phase. Then the test will end. And there are some very important things to remember before your CPET. No food, caffeine, energy drinks, or pre-workout for at least 3 hours prior to your appointment. If you consume any of these within the 3 hours prior to testing, you will need to be rescheduled. We ask that you abstain from a heavy workout 24 hours prior to your appointment and bring a list of all medications that you are currently taking. Lastly, if you have a hairy chest, please shave the night before. We hope that this video has been helpful and has provided you some information that will help you prepare and even look forward to undergoing your CPET. The information that you will be provided about your cardiovascular health will be immensely helpful in identifying the presence of cardiovascular disease and what you can do to reduce it. We look forward to your questions and seeing you soon. Thanks.
We hope that you found this video helpful. If you have any questions at all, please reach out to us through email or call us directly. Everyone at Frontline is committed to helping you reduce suffering and prevent the onset of disease so that you can continue to protect the people of your community and make it home safely. We look forward to seeing you soon.